Namaste to all. I hope my slides are visible to all. Okay, so namaste to all from India. I'm here to give a presentation from India on how smart nursing future can be made possible. To begin with, I would like to thank Jia Lee for creating this platform, for having us to share our information and share our knowledge with each other at this platform at KSN. Yes. To begin with the introduction of the country from where I come, India, it is the largest democracy in the world today. Also with the world's largest population of 1.43 billion people as per 2021 statistics. We also have the largest number of English-speaking people in the world, probably in our country. We are also the third largest economy in the world. And since this is relating to technology, I thought it's important to share that the country has the world's second most smartphone users. That's 659 million people as per 2022 statistics. Going next. The common health problems in India, what we have today include the non-communicable diseases. As I know that non-communicable diseases is a global epidemic. The NCDs that are of importance as per the government of India include diabetes mellitus, hypertension, including the cardiovascular diseases. We have chronic respiratory illnesses and three major cancers that we focus on. That is the breast cancer, cervix cancer, and oral cancer. Apart from this, the other important health problems for consideration are tuberculosis, malnutrition and anemia, which is rampant across all age groups, and low birth weight among the newborns, which is leading to a lot of neonatal deaths. I've just taken few very important issues that are on the government radar currently. We have many more important health issues that we would like to address in the country. With regards to the healthcare system in India, there's a mix of public and private healthcare system. Approximately the government healthcare system, that's a public healthcare system, caters to 30%. I mean, it constitutes of 30% of the health systems that exist in India, and a large part, that's the private health sector, is around 70% of the healthcare systems that exist in India. So, of course, recently in 2020, the government of India launched an Ayushman Bharat, a national digital health mission, which was launched on 15th of August on our Independence Day in 2020, middle of the pandemic. As per this national health mission, every citizen can have a unique health identifier number and a health account that would be created. This is still in a pilot project is going on certain states. Similarly, during the pandemic, an e-Sanjeevani program was started, which is an online consultation from the public health sector doctors that was made available for people in the country, which is fairly doing good, and it is continued even after the COVID in the country. We have also launched for mental health a Telemanas program. It's a telehealth program that is where a large number of nurses are also involved in providing mental health counseling for people in need. There's a toll-free number when a person calls, including some of the nursing professionals, doctors, and trained counselors would attend to the person's call and provide timely counseling. So, coming to the common other health concerns that probably we see in hospitals that are of concern are patient safety, uh, especially with regards to medication and fall safety, and probably devices that we would require to help us with prevention and prediction of pressure ulcers and also management. I just thought I would share some of the applications that were recently developed in India and have been successfully used across the nation. To begin with, there's a TB Arogya Sathi app, which was developed it uses an artificial intelligence and machine learning algorithms. It's a mobile based app where all stakeholders involved in TB care can access the patient's treatment information, and patients also have an access to nearest diagnostic center, nearest center where medications can be made available. There's also an incentive that is given to patients who take their treatments regularly, and this app helps them get their funds into their accounts. This app has been widely used by the ASHA workers. ASHA workers are community workers. ASHA is an abbreviation of Accredited Social Health Activist, who's a kind of 10 pass lady, native of a village, who's given a training, and she acts as a link between the health workers and the community. This app has been also used by the community health officers, who are now the in charge officers of health and wellness centers, which were created under Ayushman Bharat scheme in 2018. And around 80% of the CHOs currently in India are nurses who are using this TB Arogya Sathi app. Apart from this, TB workers and other NGO staff are also using this app. Niksha is another app that was developed, which is again an ICT system in a mobile application. It helps to efficiently monitor and track TB services, and from screening to follow up. This is also used at all different 6 levels across the country. That's at national, state, district, and at the tuberculosis unit level. This app has been successfully used. Another app that was developed in India is Shwasa. Shwasa literally means breath. It's an AI and ML-based technology. It uses a contactless real-time screening and monitoring of respiratory diseases with 93% accuracy. Once you download this app, a person is required to cough into the app in his mobile phone device where he's downloaded the app, and based on the acoustic signal, the app detects whether the person has any what do we say, an obstructive airway disease, and it generates a report immediately and directs a person to seek medical consultation if necessary. So all these apps have been widely used by grassroots level nurses who work in public health care, largely for screening of patients, because I think, as Howard Catton rightly said in his inaugural address, that we need to look at basically AI ML technology in public health, where we can reach people and we can use these technologies to screen and get people at the earliest to have medical help rendered to them. Another app what is developed in India is called Poshan Tracker. Because as I said, the malnutrition is a big issue at our place. This app uses an artificial intelligence and machine learning algorithms, wherein if we take a picture of a child, it would automatically give whether the child information, or it will generate a report that whether the child is stunted, having severe acute malnutrition, moderate acute malnutrition, and so on. This app has been downloaded by more than 100 million people in the community across the country, and it has been successfully used. Another app that was developed is again an AI-based app, which is called abbreviated as MAP, a malnutrition assessment and action plan app. This is so this is an AI-based app based on WHO metrics. It again analyzes based on photography the tool, and it is connected to the portion tracker, where it would give suggestions as to what next actions needs to be taken for a child who's malnourished. Again, this app has been used by the ASHA workers and CHOs in the community, who are largely nurses. NIADA is another app that was developed, which is AI and ML based, non-invasive, real-time smartphone-based app, which helps to detect anemia, where a person can use this. Once he downloads an app, he can take a picture of his inner eyelid, canthus, and the app would then, based on the machine learning and AI algorithms, compute whether what level of anemia he has, and also provide directions as to how to titrate his dosage of iron and folic acid, or whatever treatment he's been taking for anemia. The RAMAIAH is another app, which is a low-cost, accurate, and automated portable cancer screening tool. As I said, the breast cancer is the number one cancer among women in India. And this tool uses a thermal analysis technique where a picture is taken of a breast in a particular position where the lady is seated. It's a non-invasive technology. The machine learning algorithms would identify the thermal changes in the local tissues, and based on which they would suggest whether there is a possibility of this person to have a breast cancer. And basically, this app is used for screening. And then if it shows positive result, the people undergo the diagnostic further test. Over 125,000 women have been so far screened in 30 Indian cities across 200 plus hospitals. This app has been widely used now in India, and availability of this app is also extended to UAE, Kenya, Sweden, Turkey, and Philippines. It has around 90% of accuracy rate in detecting early cancers, which can easily be used by nurses to screen people to identify diseases early. SurveyScan is another app which again uses the machine learning algorithms and LED lights for non-invasive identification of cervical cancer, the cervical intraepithelial neoplasia. This is again a very low-cost device. The first prototype was tested on 109 patients in one of the hospitals in southern India, and this is still in pilot projects. Because the next big cancer we have in India is cervical cancer. Spinefall and AGZ are two apps that were developed to remote monitoring of fall detection and fall prevention, which have been widely used in old age homes and home environments, or home-based. The home health nursing agencies have been using these apps. Coming to what probably more is really required in India in terms of technology that would help the largest number of population. We thought it could be, we know that there are devices already available, non-invasive devices that sense the blood glucose levels. However, these devices are expensive. So we probably thought a non-invasive blood sugar and blood pressure checking devices with great accuracy and a very low cost with advanced technology would be very helpful, because a lot of other health problems that are there in India, like cardiovascular diseases or chronic kidney disease, hypertension, all of these are related some way to diabetes mellitus, which we are the world capital of diabetes mellitus. So I think we need to focus on technologies that could identify or pick this at the earliest. The second recommendation, we thought that there's something more that can come, is we don't have currently any technology that can ensure medication safety, or at least partly help in that. So work probably needs to be done on that. Fall prevention, sensor beds are there, but a lot of falls happen because of nurses forgetting to put up the side rails. So we thought if side rails with sensors could be helpful. A lot of nurses' time is also wasted at bedside in doing non-nursing activities like inventory taking. So if we had applications that could help them, or technology that could actually help with these kind of tasks that are repetitive and doesn't require an attention of an expert person, would help. Another thing that we thought would be helpful is non-invasive devices for anemia screening. We of course have for adults, but anemia is also a big problem among the under 5 children in India. So we wish to develop in your future technology that could be non-invasive and easy, also as well as low-cost technology to do anemia assessment among the under 5 children for screening purposes in schools. I would like to thank my colleagues, Mrs. Lata, Sushar, Ameri Roy, Ramya, Arul Shanti, and Mr. Ganga Prasad Sharma, who have helped me compile this presentation. Thank you. I hope this information was useful for all.